I don't define myself as I'm diabetic. I'm a person that has diabetes. And I don't always feel compelled to say, hi, my name's Dave. I have diabetes. You know, it's not the first thing out of my mouth. Having said that, I'm not afraid to tell people that I have it. I think it's sometimes important to let people know, particularly in situations where, in fact, you may need some assistance to correct a situation or somebody to help you identify that you might be getting a low glucose. Um, when I was a single man, dating was always a challenge. When do you tell somebody you have a chronic condition, which many people used to think was very, very serious, very damaging, and inevitably would cause great harm? It is a serious disease. It shouldn't be taken lightly, but the reality is we could really minimize the probability that you're going to have a lot of secondary complications from it. And that's luckily something that occurred in our lifetime when we learned that good control really has a big positive impact. And we now have the mechanisms for getting in good control. So all that's positive. I did have to think a little bit about how do I introduce that, but it's sort of like anything else, At some point, I say, let's talk about our health. You should know something. I have diabetes, and it means that sometimes I have to do certain things, like check my glucose or test my sugars or something like that. But rarely have I had that be a negative experience in my life, or rarely have I had people react negatively to it. If they do, I try to educate them so they understand it a little bit better than perhaps they do before I'm done.